Death and dying are sensitive topics for many people. As a CNA, you will probably work with many people who are dying or have family members who are dying. In this section, we will review the grief process surrounding death. Death is a natural conclusion to life. How the patient and their loved one respond to the dying process is based on many factors, including personal, cultural, and religious beliefs and experiences. Let's start by discussing how a patient might approach their grief about the dying process. Everyone grieves differently, and each death is unique. But there are some commonalities in the stages experienced during grief. This can include both the grief of the dying patient over life ending as well as their loved one's grief of loss. You may have heard Dr. Elizabeth Kubler-Ross's stages of grief. They are denial, anger, bargaining, depression, and acceptance. Let's summarize these stages and how you can best meet the patient when they appear to be in each stage. Let's start with denial. Denial is avoiding the situation by attempting to forget, numbness, and shock. Grief can be overwhelming, so denial is commonly presented by pretending the loss isn't happening. When talking to someone in denial, you should answer any patient's questions honestly and openly. Meet the person where they are, and do not push if they are not ready to talk. Anger can present as irritability, aggression, sarcasm, resentment, or impatience. Anger is a coping mechanism to hide the emotions of grief, so you may see anger directed at others, including you. When you experience someone who is angry, the most important thing is to stay calm and remove yourself from the situation. Let the angry person cool down. Remember, the anger is about their need to process grief, not about you necessarily. When people feel helpless, they may try to bargain. Bargaining can present as guilt, shame, blame, comparison, and perfectionism. You may see the person try bargaining with a higher power. Again, meet the person where they are. You can answer questions honestly and openly. The first 3 stages are considered active. Depression may look like the opposite. Depression can be presented with sadness, despair, helplessness, and crying. The person may become quiet, turn inward, and process the change by themselves. Avoid saying things like, "Snap out of it." Let them know you are present, but give them time to process. And finally, acceptance is just how it sounds. Acceptance looks like validation, wisdom, courage, mindful behaviors, and pride. Acceptance is understanding and accepting the loss. Although it may sound as if they have moved on, acceptance doesn't have to be happy and doesn't mean they are over the grief. It just means they've accepted it as a reality. The stages are often talked about as a linear process. This is how we expect to go through the grieving process. But that's not how grief works for everyone. People may expect a linear path, but for many, the process bounces around. They may go through acceptance, then bargaining and denial, back to acceptance. Grief is complicated and messy and not always linear. This means you can't expect any one path for the dying patient, their family, or even yourself. You just support them where they are. Death is a natural process, and we all respond to death differently. It is important that we recognize how and why we react the way we do, so we can turn these into productive and peaceful situations.